It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our next guest is June Robinson, Representative June Robinson. And immunizations, Shannon, have become quite a controversial topic. Some parents say, nope, we're not getting them. Other parents believe in them. And a lot of people think because of the measles outbreaks we've had that they're really necessary.
I agree. I think they are necessary, and there's exemptions that the state of Washington has, but it has become a law this last session.
All right, here's Representative June Robinson and Shannon O'Kelly.
Representative June Robinson, welcome to IRG's Health Talk. How are you?
I'm great. Thanks for having me.
Well, I'm glad you're here. We've got some stuff to talk about, and what we're going to talk about today is vaccinations. You just came out of session, and I think you were working on a bill requiring vaccinations. But before we get to that, I'm fascinated about your background. I got to tell you, I was reading your bio, and you did Peace Corps work in Jamaica. You're a nutritionist. You're in healthcare. So you have some firsthand experience. But tell us about your background and how you came to the 38th District. That's fascinating.
Well, like all life stories, it's a winding road. So out of undergrad, I grew up in Lancaster County, Pennsylvania, far from Everett, Washington, and went to the University of Delaware undergrad. And then out of undergrad, I went in the Peace Corps. And I had enough of a nutrition background that they assigned me a spot in rural eastern Jamaica, working as a public health nutritionist in their public health system there, which for a young woman without a lot of life experience at that time was a really seminal experience that, set my values and taught me about public health and how it's sort of an intersection, I like to say, between people and science. You're working with the population, with the public, but you're using the knowledge and principles of science to improve health. In that space, I was working specifically with mothers of young children. Jamaica was concerned about young childhood nutrition at that time, and so we were focused on kids 0 to 3, and getting them immunized was a big part of what we worked on. So that was my first introduction to public health and helping people access both good nutrition and good health. Again, a big piece of that is making sure that kids were immunized. Then because of that experience, I came back to the States and went to the University of Michigan to do a master's degree in public health. And then from there, I've worked in the nonprofit sector pretty much the rest of my career. And I came to Everett in 1998 when my husband at the time took a job with Boeing. So we moved our young family to Everett at that time. And I worked for many years at Community Health Center of Snohomish County, which is a nonprofit health and dental clinic in Everett and Linwood. And again, just helping people get access to the health care that they need to keep their families and themselves healthy. And more recently, I've worked in local public health. I've worked as a project manager at Seattle King County Public Health. And then along the way, got involved in politics. And it's not something I ever saw myself doing, but it's really a continuation of my career in public service and just working with the community to make sure that they have access to what the services that people need and deserve in order to live healthy, productive lives. So I was elected first in 2014 and have been elected since then to serve the Everett, Marysville, Tulalip area.
And by the way, you're doing a fantastic job. And the analogy, long and winding road, that's great. That's you described a long and winding road there, but the experience you have is incredible to see it firsthand. And we live in this great country.
Right.
And we have this healthcare system that's just amazing. And you sit on a healthcare committee here in the state of Washington, and you just have to pick up the newspaper or listen to the news, and there's a little controversy out there with vaccinations. And we've had recent outbreaks of pockets of measles. I mean, just recently, I think there was an outbreak somewhere in Oklahoma, if I remember right. I don't know. But they're occurring. So tell us about vaccinations and what we're trying to do from a state legislative standpoint.
This past session, we did pass a bill that will require students, when they go to our K-12 public school system, to show that they have been immunized for the measles vaccine. Now, currently, we do require immunizations in order to attend school, but this particular bill just tightened the requirement for the measles vaccine.
More with June Robinson and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We're back with 38th District Representative June Robinson and Shannon O'Kelly talking about immunizations.
So Representative June Robinson joining us. We were just talking about your history, your experience in healthcare, and more importantly, recently you passed a bill requiring vaccinations for K through 12. This has probably been something you've been working on for a little while because there's been these outbreaks. Is there something that really spurred on this bill this year in your experience?
Yeah, thanks for that question. In fact, as we were starting the legislative session this year in January, there was a measles outbreak in the Vancouver area. And so it was legislators from that specific community who really championed the bill this year. I had worked on similar policy a few years ago, but didn't get it passed at that time. But with the outbreak in Vancouver, those legislators seeing how much it was disrupting their community, kids needing to stay home from school because they weren't immunized, and just the cost, both in human terms and actual financial terms, to that community really gave the policy momentum. So what we did was just say that there's no longer a personal and philosophical exemption that parents can use to not immunize their children for measles in particular. And the reason we focused on measles is, A, we're seeing these outbreaks both in Washington and around the country. It's a highly communicable disease. Mm-hmm. It is very easy to spread from one person to another. And so it is important that we really get the immunization level for measles as high as we possibly can. And removing that personal exemption is one way to accomplish that.
Yeah, when you talk about highly contagious, I mean, measles, an outbreak of measles in a school, not just affects the individual that maybe has the disease, or it's the whole school. They shut it down. They have to shut it down, clean it. I mean, and it affects the entire community, like you said. It's big stuff.
It is big stuff. And, unfortunately, there are people in any public setting that are immunocompromised, that can't get immunized. And so it's for those folks, it's protecting the larger community is really what immunization is about. It's for your own personal health, but it's community health. It's about us looking out for the whole community. So,
and is it the state of Washington one of the few states that has this bill, or is this pretty common across other states in the country? And maybe that's a loaded question. I don't know.
No, states vary in the exemptions that they allow parents to use. All states have laws that children need to be immunized to go to school, but then the way you're able to exempt varies somewhat. Everybody has a medical exemption, so if you're truly unable to be immunized, you can get exempt. Many states have a religious exemption, and we do have that in Washington as well. So if you're a member of a religious organization that really does not practice immunizations, you can use that exemption. And then some states have the personal philosophical exemption, which has been used quite a bit here in Washington state, and that's what we're trying to narrow.
As we look into the summer months and look into kids going off to college, meningitis is a big thing in college. Is there going to be a requirement that you have to be immunized to get in?
There is not that requirement. We have talked about that, but just have not had the political will to make that happen. It's a little harder to implement as well.
Well, good stuff. Representative June Robinson, thank you so much for joining us. And I have to say, I'm proud that you're from Everett, because I'm from Everett too, and you're doing a fantastic job for us. Thank you for your service.
Thank you very much, and thanks for having me.
Well, Shannon, this is, as you discussed, it's been a topic that people talk about based on religious beliefs and other beliefs that they don't need the immunizations. But, boy, I think when you have the opportunity to keep your children or others from getting something like measles, it's well worth the effort.
Oh, you're absolutely right, Tom. Like Representative June Robinson mentioned, it's community health.
All right, thanks to her. Dr. Carly Squires is next on Como.